Hi, my name is Kathleen Lisson. I'm a certified lymphedema therapist and board certified massage therapist, and we're here at my practice in San Diego, California, and I'm the author of the Lipedema Treatment Guide. I want to talk to you today a little bit about lipedema and a type of massage that I give here to help people with lipedema. It's called manual lymphatic drainage. So I use manual lymphatic drainage to help people reduce their swelling after liposuction surgery that they have, to reduce their lipedema symptoms. And it's also good if they're not having surgery and they just want to help reduce those symptoms. So manual lymphatic drainage is a gentle skin stretching stroke. It's a very gentle massage. And what it does is get the fluid, excess fluid, out from the interstitium into our body's lymphatic system, which is our body's recycling system. And so the body can process all these waste products, and then in the end, the excess fluid is just urinated out. So they end up peeing all night. So why is this good if you have a diagnosis of lipedema? So we know through research that the interstitium is actually enlarged in lipedema. So we need to get that excess fluid out, and MLD can help. It also improves the microcirculation. It improves capillary fragility, and these two improvements in these two things can also reduce the pain associated with lipedema. So that these are some very good reasons to try manual lymphatic drainage if you have a lipedema diagnosis. But one of the questions that people really ask me is, how do I get diagnosed in the first place? How do I know? And more importantly, how can I work as a team with my physician that I already have to have, a comprehensive, a better treatment experience and get some help for my lipedema? And what I have seen from a lot of stories is, frankly, a lot of physicians, medical personnel, if they don't know about lipedema, they might think it's an internet disease, a fake disease people made up, even though it has been described by Allen and Hines in the 1940s, and they were in the Mayo Clinic. So it is absolutely a real disease, and it's been known and described for at least 80 years. But a lot of people, the majority of people definitely don't know about lipedema. So it's really difficult for people to get the quality kind of care, to find someone that knows a lot about lipedema and is able to help them. So if you can find a doctor that knows about what lipedema is and exactly how to treat you, that's amazing. Definitely keep that doctor. But if you don't have access to a physician like that, you have to bring resources to your physician. So it might be the Lipedema Treatment Guide. You might do some reading and then say, hey, I want to partner with you, my doctor, and let's look into some of these treatments together. One of the major treatments is compression, medical grade compression. Another thing might be to go to some kind of vascular specialist. Many vascular specialists will know about lipedema far more than just a regular family physician. And indeed, there's an article in this month vein specifically about compression garments for lipedema. So find these resources and bring them to your physician, especially if your physician is a vascular physician, and you might get a great the tools you need to start a partnership with your doctor. And other things, definitely don't feel like you're alone with this disease. There are a lot of people out there that also have a lipedema diagnosis, and there's many groups on Facebook where you can virtually meet people who are suffering and feeling the same confusion, pain, frustration, agony as you are day in and day out. And so you don't have to feel like you're alone and no one understands you. There are definitely Facebook groups for people with a lipedema diagnosis out there. And the people are very welcoming, and they're very willing to lend an ear and lend a shoulder and, give your story the honest hearing that it actually needs, because that's the most important thing, I think, in the most important and first step in the journey towards treating your lipedema, which is a chronic disease that we don't have a a cure for yet, but we have a lot of good treatments for it, is the first step is to feeling like you're truly heard. Like you're truly heard and someone else out there understands what you're going through and understands your story. It doesn't have to be the same for them, but you definitely need at least one other person out there that you feel like, you know, they really have your back. They really support you. And the Facebook groups can definitely be that way if you're not lucky enough to live near a medical expert that has taken a real interest in lipedema as a disease that they study and that they can truly support you in. So it's not ideal. Many things aren't ideal. We don't have a real clear understanding of what lipedema is. We're doing more research every year to get clear with that. We have a lot of research that supports several different types of treatments. So if you're interested in getting some of the conservative treatments, definitely look into the resources that are out there and make a plan, and then go to your physician and your doctor and say, hey, I want you to be a partner. Let's partner together, and I understand this disease, and I want you to understand this disease as my physician, as someone who is working for my health for the rest of my life. And I want to work in partnership because the majority of the doctors will not know everything and have a clear plan on what you should do to treat your lipedema. They just won't know, and we know this. So the idea is to get the tools yourself and get an idea of what you want to do and what you want to try first, and then go to your doctor and say, hey, here are some resources. And, you know, more than just, I saw this on a website, I printed it off. Get something that's written by a fellow medical expert that they can really look at and understand, and then work towards using those ideas that you find in these resources by medical experts to get a plan of treatment yourself.